Welcome back to Close Up. This year will mark a full decade since then Manchester Police Chief Nick Willard called out the Department for Children, Youth and Families, DCYF, following the homicide of Sadie Willott, saying the state failed the 21-month-old girl killed by her own mother. That helped spark a push for reform that is ongoing. Here to discuss the latest in that process is child advocate Cassandra Sanchez. Ms. Sanchez, thanks for joining us.
Yes, thank you for having me. Good morning.
So the governor hasn't released her budget yet, but we know it could be a tough year with potentially cuts in store. She may try to shield DCYF. We'll see. But part of the problem 10 years ago was that, caseloads were enormous, in part due to some budget cuts that happened in 2011. There were very few workers dealing with a massive amount of cases. How concerned are you about a relapse or repeat of some of the issues that happened a decade ago if there are more cuts this time around?
I do feel quite confident that DCYF and greater DHHS are really managing their budget in a way in which they are protecting the positions that they already have. Caseloads have been manageable as of late, which is wonderful to see. And so if they are able to maintain what they have, they may not get more. But as long as they can maintain what they have now, I do see them being able to maintain the lower caseloads and an ability to get out there and see children and better protect our state.
In your reports lately, you've said that, caseloads are at historic lows. What's driving that? Obviously, there's more personnel, but is there anything going on outside the state agencies?
No, I truly do believe it was their ability to staff up the agency. They have very low vacancy rates. There were times of high turnover that has settled down quite a bit, which is always wonderful to see. The longer workforce are doing this work, the better experience they have, the better able they are to address family needs and have a really short-term working relationship with the family before they move them on to other services and close out. And so we're seeing a lot of that happening. We've also seen in that time quite a bit of growth in our children's system of care, which is critical. And so having those services out at the community level so families don't have to end up in the deep end of the system, catch them early on, is going to prevent that need. And so we have those services now here in New Hampshire. They're serving very many families across our state. And so having both happen at the same time is going to, and if we can continue that and funding those services specifically, then we can continue to see those case numbers stay low and see only the highest need families end up working with the system.
So, before the last budget, they were essentially saying that, this disparity in pay was harming DCYF's ability to recruit and retain versus other states surrounding. You're saying that's kind of evened up now and it's not as much of a problem?
It's gotten better. We still are not necessarily equivalent to some of our neighboring states, but it has improved significantly, including that 10% raise about a year ago. That has absolutely helped the workforce. And again, it also takes just the greater system, having assistance, having places to send families and not always just that system, allows folks to stay in the work, not get burnt out as quickly and as easily. And so we are starting to see that as well.
And you've got this oversight and accountability function. In your reports, the last three of them, it's interesting to see that you've been, a little critical of DCYF culture and some resistance to some of the, change that you want to bring. Explain what's going on. Absolutely.
Well, the agency as a whole has had a lot of change. Our office is still new, especially in regards to the length of time they've been around. So it's a difficult working relationship. Oversight is hard for folks. And so I think with the changes in leadership, there's been some bumps in the road. It's made it difficult to necessarily have the same working relationship with the different turnover of leadership, but we work really hard at that. So myself, the leadership in DCYF, we meet on a regular basis, really trying to build those relationships so that they know when we are intervening in cases or with overall larger system review reforms that we're recommending, that it truly is to help the agency make those strides forward as they have over time and to acknowledge the work that they've done, but also say, there's continued growth to be had. I'm yet to find a child welfare agency across the nation that's got it right. And so we're constantly reminding them of that, but it's really taking time to spend building those relationships so that they do see us as a helpful agency and not someone who's here just to point the finger and say they're not doing a good job. That is not at all our intention.
Right. In your September and October reports, you do say you were blocked from access to documents. They told you they would do certain things and they didn't. And you just said a common response is, quote, there is no need for change, although the system isn't working properly.
Yes, and I will say I've seen some change already from that. I've seen some willingness to have some of those more difficult conversations with our office around where we're seeing struggles, a willingness to take a look at the different district offices, how they're operating, ensuring there's some consistency across the state. So those improvements are starting to come, which is what we really wanted. And so part of highlighting that out publicly is, one, to make sure that folks in the community have transparency in what's happening in our child welfare agency, but also to highlight to them that this is where we want to be. Now let's really work together to get there.
It was interesting to note, too, you have some data from April of 24 to October of 24, 27.61% of calls, 4,170 calls were abandoned coming into the central intake. What's happening?
Yes, so we heard at that time there was a lot of turnover specifically in the central intake. So those are the folks that are answering the other end of the call when somebody is calling with a concern for a child. And so they weren't able to get to calls, or they would be on a call that would take a long period of time, and then other calls were missed in the meantime. We understand a lot of efforts were put into hiring in that particular area of the agency. There was some onboarding that happened in the fall, and so my hope is that in the next data lump that we receive is that we see that there are actual changes to that. We talked quite a bit about what they were doing to work around that, to reduce that turnover in calls, and so there had been some work that they were doing internally, finding ways to ensure that they were connecting with law enforcement, and that they were either having folks that maybe weren't necessarily trained on answering the phone, but to take that phone call, write down a number, and have somebody call back. And so really what we want to see now is that there's a reduction in that number, because that is concerning to us. Do people then pick up the phone again and call back? Or if they've waited on hold for an hour, are they just saying, this isn't worth my time, or I don't have time to continue to call back and call back? And then if those calls are dropped, what is happening for those children? Are they going to be safe? So that's always a worry for us. We want to make sure that those calls are getting through. They're talking to a professional, and the professional is vetting the information as to whether it is reaching the level of abuse or neglect. And so it is a large focus of ours to ensure that that central intake is answering the phone every time it rings.
And there's this double-edged sword to all of this that I think we've discussed before, you know, that there's so many people working to make this system better. Obviously, the sunlight and the accountability and the oversight that you bring is important, but, you know, when there's a lot of negative public attention on the agency, it can be demoralizing to the people who are there doing a good job. So you kind of have to walk this narrow path of holding the accountability, but also not necessarily throwing the wrecking ball too hard at the system to make sure that the good people who are there stay and people want to come on board.
Absolutely. You nailed that perfectly. That really is the fine line that we have to walk. Oversight is difficult. As I mentioned, right? It's hard and it's uncomfortable for folks. And having done the work myself and having staff in my office that have done the work ourselves, we are constantly acknowledging the hard work of the agency and the folks working in the agency. We know their intentions are to truly help and protect children. And so we work to highlight that while also saying there's always room for improvement. And how do we work together to get to that point of improvement? Because we need buy-in from the staff as well to want to do things differently.
Do you think one of those improvements should be breaking DCYF out of HHS and making it its own standalone department?
I'd be concerned with that. I've heard that floated as particularly in legislation this year, and I worry about that. Where would their infrastructure be starting fresh from the beginning? A lot of money exists within DHHS, and they have the ability to go to fiscal and move that money around if needed and ensure that DCYF is always funded appropriately to meet the needs of our community. And would they lose that aspect if they were branched out on their own? And the cost of just setting up a completely new agency, I understand it's been discussed, not only DCYF, but Bureau of Children's Behavioral Health that oversees our children's system of care and those services. And oftentimes those are the services that are protecting our families by being those preventative first touch services. And so if they are branched off on their own, they don't have access to this larger pool of funds and the infrastructure that's within DHHS, could they sustain the good work that they've done thus far and continue to grow and build out? And I'm not sure that they would.
We spent a lot of time on child protection, my fault, but I know you do so much more. Are you optimistic that with Hampstead Hospital expanding, that the child mental health system is going to start seeing more improvements as well?
Yes, I think, we've made good strides. Dartmouth is well renowned in our state and known for the good work that they do in this arena. So having them take over the hospital, I think, is a very good move. Also acknowledging the budget and how much the state budget would impact the work that could happen at Hampstead, with hopefully it being now under Dartmouth. They can do some additional work, cleaning up the building space itself, providing more intensive psychiatric services in the building, as well as continuing to connect to that larger children's system of care, because we really want to ensure that when children are in their highest need and they end up in Hampstead Hospital, when they return to the community, they have what they need in the community to catch them, so they don't have to return back. And I'm very hopeful we're going to start to see some more of that with this takeover from Dartmouth.
All right, Cassandra Sanchez, New Hampshire's child advocate, thank you for joining us on CloseUp.
Thank you again for having me.
And when we come back, Governor Kelly Ayotte is sending a message to the company trying to build a controversial landfill in the North Country.